Okay guys, let's talk about heart failure. So in this video, I'm going to talk about the pathophysiology and the medications that we use in the treatment of heart failure. So I want you to know that in the United States, we have around 6.7 million adults that are living with heart failure, and it is projected to rise to 8.7 million by 2030. So pathophysiology of heart failure, basically, it is a clinical syndrome that develops when the heart fails to pump at a rate that is commensurate with the requirement of the metabolizing tissues. Okay guys, the diagnosis of heart failure. According to WHO, this is how we diagnose heart failure. So the patient must have two major criteria, or one major criteria plus two minor criteria. So what are the major criteria? So the major criteria are significant tachycardia, raised jugular venous pressure, the third heart sound. Well, for the minor criteria, there are just 5. We have like ascites, by basal rales or crepitations, pleural effusion, tender hepatosplenomegaly, or bilateral fetal edema. Okay guys, let's move on and talk about the principles that we use in the treatment of heart failure. So we have to reduce the preload, we have to reduce the afterload, we have to increase myocardial contractility, we have to also prevent thromboembolic phenomenon and supportive treatment. Okay guys, let's move on and talk about the 4 pillars that we use in the treatment of heart failure. So we use mineralocorticoid receptor antagonists like spironolactone, we use beta blockers, we use sodium glucose cotransporter 2 inhibitor like dapagliflozin, and we can use all these ACE inhibitors and the ARBs and the ARNIs. For the ARNIs, you combine what? Angiotensin receptor blockers and what? And neprilysin inhibitor. So in this case, you can see that we combined telmisartan and sacubitril. So that's how it is. Okay guys, let's move on and talk about the categories of drug that we use in treating heart failure. So here we have 20 categories of drugs, but let me just mention them. We have the ACE inhibitor like captopril, we have the ARBs like losartan, we have the diuretics like we use the loop diuretic and also the thiazide type and thiazide like diuretics. So take note of that. We also use beta blockers, we use mineralocorticoid receptor antagonists, we use statins, we use antiplatelets, we use anticoagulant, we use calcium channel blockers, we use vasodilators, we use inotropic agents, we use nitrates, we use angiotensin receptor neprilysin inhibitor, we use cardiac glycosides like digoxin, we use vasopressin antagonists like tolvaptan, we use phosphodiesterase 3 inhibitors, we use the B-type natriuretic peptide, we use the sodium glucose cotransporter 2 inhibitor, and we also use the IF current inhibitor like the ivabradine, the soluble guanylate cyclase stimulator, So let's talk about harmful drugs that you cannot use to treat heart failure. They are harmful. So NSAID are harmful, thiazolidinediones are harmful, and most calcium channel blockers are harmful, except amlodipine and felodipine. And you cannot combine ACE inhibitor, ARBs, and aldosterone antagonists together. It is harmful in heart failure. So, and also cyclooxygenase 2 inhibitor like celecoxib, you cannot use it. They are harmful for heart failure. And you should also avoid these drugs in treating heart failure. You have to avoid antiarrhythmics. You have to avoid tricyclic antidepressant. You have to avoid biguanide. You have to avoid trimethoprim sulfametazole. Guys, hyperkalemia inducing drugs that we can also use to treat heart failure. There are 5 of them. We can use them to treat heart failure, even though they are hyperkalemia inducing drugs. Beta blockers, potassium sparing diuretics, cardiac glycosides, ARBs, and also the ACE inhibitor. Okay guys, bye for now.